Greetings of the day. We are going to discuss about pathophysiology of bomb blast injuries. So an explosion is an instantaneous transformation of a solid or liquid into a gas. So there is a state change, right? So from solid or liquid state to a gaseous state. So there is a release of tremendous kinetic and heat energy along with it change. So the detonation of a conventional high explosive generates a blast wave that spreads out from the detonation point, and it displaces air, water, or anything in its path. So the blast wave consists of two parts. So shock wave of a high pressure and followed closely by a blast wind, which is air mass in motion. So the blast wave loses its energy over distance and time. Now coming to the blast effects. So there are four main types of blast effects. A primary injury is caused by direct effect of the blast wave over pressure on a tissue. The primary blast injury mostly, but not exclusively, affects air-filled structures such as lungs, ears, GI tract by the following mechanisms: spalling, shearing, and implosion. Spalling. It is a displacement and fragmentation of a dense medium into a less dense medium. An example of it is that a lung parenchyma, the blast wave causing the lung parenchyma to explode into an alveolar space like a geyser. Now coming to the second effect, there is second mechanism, that is shearing. Shearing, sometimes called as inertia. It is a stress caused by the blast wave traveling through different tissue density at different velocities. An example of shearing is the blast wave traveling through pulmonary vessels and air spaces, resulting in a ruptured vascular and bronchial pedicles. Implosion. Implosion is opposite of spalling. So where the less dense material is displaced into denser material. An example of implosion is the blast wave causing flexible air embolism from alveoli into pulmonary vessels. So a secondary blast injury is due to collateral damage from the flying objects and shrapnel. So the images here, you can see the secondary blast injury over the chest and abdomen, where you can see multiple spots, reddish spots. So these are due to secondary blast effects, that is due to the flying debris. It is difficult to assess the degree of the underlying internal organ injury without imaging and careful clinical follow-up. Okay, especially if the patient is unconscious. So that is regarding the secondary. Now tertiary blast injuries results from victim being propelled through the air and striking the stationary objects. That is, the victim is the propeller, or the victim is the projectile due to the blast wave. And the quaternary blast injuries is a result of burns, smoke inhalation, or chemical agent release. So these are the effects of a blast on a patient. Now the factors affecting the blast injury. So there are effects, but how does these effects factor about the blast injury? So we are going to discuss about this in this section too. So the effects of the bomb blast are difficult to predict in an individual because there are various aspects which go through during this effect. So there is distance of the victim from the explosion. If the patient is very in proximity to the bomb, the effect will be humongous. So the intensity of an explosion pressure wave declines with the cubed root of the distance from the explosion. A person 3 meters, that is 10 feet from an explosion, experiences 8 times over pressure than a person 6 meters, that is 20 feet away. The proximity of the victim to the explosion is an important factor in a primary blast injury. Now the second factor is the enclosed versus open space. So if the patient is enclosed in an enclosed place like a room, bus, train, the impact will be greater when compared to an open space, and the injuries will be severe and the mortality is greater. Now coming to the third factor, that is surrounding environment. Blast waves are reflected by the solid faces. Thus, a person standing next to a wall may suffer increased blast injury because of reflection of the sound wave, the blast wave. And so because of the secondary and tertiary parts too, tertiary blast injury too. The fourth factor is the quantity of the explosive. So we know that when the quantity of the explosion, the explosive is directly proportional to the severity of the injuries. And now the type of explosive. Explosive are commonly classified as either a low order or a high order. Low order burn rapidly and produce like more of a blast wave of less than 1000 milliseconds per meters per second. And the black powder is of a low order explosive is an example of that. And high order explosive detonate when a shock wave passes through them, causing almost instantaneous transformation of the original explosive material into a gases occupying the same volume of the space under extreme pressure, high pressures. These high pressure gases expand rapidly and compress the surrounding medium and produce a supersonic overpressure blast wave moving at a greater than 4,500 meter per second. It's followed closely by a negative pressure wave. So other factors are the embedded shrapnel. Many terrorists purposefully embed multiple pieces of metal, plastic into the explosive, maximizing the number and severity of the secondary injuries. So this concludes this video. Thank you very much.